All right. Excited to be with y'all live today. I'm so glad to be back. I wasn't able to be here last week, which is where I was scheduled to be. Wasn't feeling well, but um, God has restored me, and I'm back and excited for this journey. We're journeying together to empower your child, a child, those children to overcome ADHD. Why is this important? Because we can understand children, we can understand ADHD, and when we do, we can open our minds and our lives to what the hope that is in store for you, the hope that you can, with understanding, clear up the confusion. So many parents I talk to share with me that, and my name is AJ McMahon. And let me just, sometimes I just get excited about this journey, and I forget sometimes the little things. And thanks for being patient with me. And I'm AJ McMahon, and people talk to me and they share with me. I'm a professional counselor, right? I come to you as a parent and a person who's concerned about your well-being, your success, the success of your child. And I know that it's possible. I know your child is capable because I've seen it so often. And when we can get beyond the mysteries and the confusion or the things we think we know about ADHD to the accurate info, it can be challenging. That can be confusing in itself. But on the other side of that is hope, and an understanding is a bridge from where you are to where you may not even know you could be. Whatever stage you are in your journey, we're here to in this journey in this series. And I keep repeating the same word, but let me repeat the word hope because that's the most important word. There is hope, not only for what you can see, but I know there's hope beyond what you can see for what you, as a parent or professional or a person who's loving and helping and taking care of a child or many children. And there's hope for children, all children, because oftentimes, great majority of the time, almost all the time, they are way more capable than this world or their behavior or their emotions or experiences or our pain would have us believe. We're in this journey, this 5-part series, and we've had the opportunity to get to part 3 today. So today it's as we are journey to see ADHD as it is, not as we want it to be. Today we're going to do part 3, which is drugs and history. I'm going to tell you a little bit about why that is. You can check out the link in the description about part 2, which was entitled Disorder, Dissemination, and Divergence. Part 2 got cut off. Sometimes I have these technical difficulties as I'm learning this system and this YouTube, but I'm excited to just jump in and be here. So I'm not hesitating, even though I don't have all the setup yet. And maybe people can come alongside as time goes on and help me with some of this technical stuff. But most importantly, we get to journey together. And for us right now in Arkansas, school just started back up. And whenever you may be watching this video, I don't know where you might be with school. Maybe it's a break, maybe it's going on. School can be an interesting time, a challenging time. So wherever you are out there, I hope to encourage you. This is a marathon, not a sprint. And that's oftentimes because the pain wants us to find immediate answers. And I want those for you. But a lot of times the immediate answers are more about a process of getting you on track with understanding and a plan. And it starts with accurate info so that you can put these things together with your wisdom, your skills, your abilities to empower your child to succeed. So when we look at the last time and I want to go back to Divergence from the last video because I got cut off. And here, let me just say this. One thing I want to share is a mentor that I worked with kids as a child and adolescent psychiatrist for over 30 years share with me that some kids don't talk until they're 3 or 4 years old. That is a natural phenomenon. I'm sharing this because in my over 26 years as a professional counselor, the countless hours I've spent in training, education, going to conferences, reading books, spending time with colleagues, I've only heard one person, one voice, the out of all the podcasts, the videos, countless of these experiences and exposures to information, I've heard one seasoned person who dedicated their lives to understanding kids and families express that this can be a normal phenomenon. That opened my eyes for me to be able to look and see it for myself. That there are normal things that the world is classifying as disorders that we are concerned about. I believe that as a parent of two children myself, if I had a child who wasn't talking by whatever age I expected that to be, goodness knows by 2 years old, I probably would be freaking out. But I would hope that my understanding and the wisdom that that's been shared with me will help me maybe be a little more patient, because there are a lot of things that happen with kids that are hard to understand, that don't fit the profiles, that don't seem normal, but are. And we get an opportunity to get beyond this narrative of disorder and understand kids for who they are. Because that, when we talk about divergence, I see that as one of the biggest divergences. We are diverging from a true understanding of kids. We're diverging from our humanity. We're diverging from seeing ourselves as unique and different, that we don't always fit into a box or a category or a title or a label, and that's okay. We may want one for a sense of security, but sometimes we have to have the courage to say, you know what? I'm different. I'm unique. I'm human. And we don't need an explanation or justification for that. So we've got the opportunity, as we talked about last time, to take off the glasses, take off the glasses, this that we see kids and ourselves through this lens of disorder or divergence or whatever it might be, to see our humanity, to see our uniqueness. What's so important about that? Because that opens the door past the confusion to a deeper understanding and acceptance of ourselves. And that acceptance is not complacency, it's the opportunity to grow. So, thank you for letting me uh, kind of wrap up the last time they got cut off. The more important question that I want to challenge you all to ask yourself as we finalize part two, disorder, dissemination, and divergence. The important thing I want to challenge you to ask yourself is, how can I empower myself and or this child to overcome the challenges? All right, so we're going to get into drugs and history. This is part three of our journey today. Before someone swallows a pill, we swallow the lie. When we look at history, when you look at the history of ADHD, there are three things that I want to really encourage us to do. A, B, C. One, ask, or sorry, A. Numbers and letters, get those confused. Maybe I need to go back to first grade like my son. Okay, so A, ask. Ask questions. Ask what this means. Ask, where did this drug come from? Ask, where did this understanding come from? What is the source of your information? Ask questions. B, beware of backwards. Oftentimes when history of ADHD is presented backwards. You'll have people today that will bring up something from the past, and they will indicate that this person had ADHD because a person who is dead and gone. All right. No one can talk to them. No one can find out. No one can really understand them or what they may be going through. People can bring up children's books that were written, such as The Story of Fidgety Phil. People can bring up writers in history or speakers, and they'll pull out a line of text and they will say, well, this is what it means, because it is a backwards look into history to fit the current narrative. Beware of backwards. Beware of anyone who presents historical information from a look back perspective. Oh yeah, this is what this person had back then. This is what this person said back then. This is what this meant back then. What can we do about that? C, context is what we can do about that. Take an opportunity to go and read not only that children's story of Fidgety Phil, but read about the author and what was going on at that time. This information, believe it or not, sometimes can be hard to find, but believe it or not, is often not that hard to find. You can find a little bit of context. If someone talks about Abraham Lincoln's son, Tad, who people are saying today had ADHD. I'm not sure that's a fair judgment. I'm not sure that Tad would agree today or what have you. We don't know. But to be able to say that someone we don't know, we didn't talk to, we didn't understand, to be able to pick out some behaviors and say, well, this is it was a disorder, that's demeaning. That is not defining. And what we're here to do is to try to get to an understanding. When you can look at whether any writers or speakers in history, just take a moment to look a little bit into the context of what they're sharing. And oftentimes, when you do, you will find, like I have, that it paints a whole different picture. So be aware of backwards and get the context. ABC, ask. Beware of backwards, get the context, and it can illuminate an understanding of history. So we're going to go forward. We're going to start from historical events that you can track and look up in history yourself. These are events that, as I was trying to understand ADHD, I just wanted to understand it. I just wanted to understand it from a historical perspective. So I started looking into the history. There's lots of information out there. What I encourage you to do is you're looking into the history, find actual historical events, or when you're reading something about maybe someone referenced something and you're checking into it yourself. ABC, ask some questions about it. Beware of a backwards, taking the narrative now and applying it backwards, and then just get the context. Try to get the context of what was going on. That's going to empower you so much. Yes, I think I'm repeating myself today. That's not one of the, that's R, that's way down in the alphabet. So we're going to kind of try to get past that today. All right, so we're going to go on. So when we can look forward at historical events, we can have the opportunity to get more of an understanding. And when you do that, vet what you check out. For example, the book ADHD Nation by Alan Schwartz has a lot of historical information. And this can be a book that can help. Also, look up another resource to be able to vet, to back it up. And usually when you can find a couple of different sources and it really gives a clearer picture of what was actually happening in history. Even what I'm sharing, everything I share today, I encourage you, find another source to verify it. You can check out the book ADHD Nation. You can, anything I reference as far as a historical event or article, look it up yourself. Check out ABC with what I'm sharing, because that's what we're here to do. We're not here to insult your intelligence or deprive you of information or throw a tagline or say this is what something says. We're here to empower you to understand for yourself accurately ADHD from a historical perspective. Drugs throughout history of ADHD is, when I say drugs, we're talking about what psychotropic drugs. And I call them psychotropic drugs because the historical information that I have found bears that out. Now, we're not talking about drugs, as in, we're not talking about something from an aspect of judgment or is this bad or is this good? We're not talking about that. We're not here for blame. We're not here for shame. We're not here for embarrassment. We're not here for any of that. We're here so that you can get the accurate information you need to make informed decisions that you can use to go into your understanding and your overall plan. And that is what so many people are deprived on. Even if they choose to encounter psychotropic drugs, which is called medicine, for ADHD for themselves or their child, they don't have a plan. And now, typically, the plan. And I say that some people may balk at that or say, "Well, I have a plan." Okay, most of the time, that plan is something like, "Yeah, I plan to give this to my child for a while. When they start doing better, then I'm going to be able to, they're not going to need it anymore." It's something like that. That can be rough around the edges, but it's something like that. However, that's not what occurs because of the challenges and so many other factors. That's not what happens. That we actually need to formulate a plan that takes into account so many different factors, that from the standpoint and the foundation of accurate information, that can empower you to have a plan that's actually going to make sense, that's actually going to be effective, that's actually going to help you overcome your fear, your confusion, your concerns, and get to the point where you can enact something that will take courage and wisdom and understanding, but will be extremely empowering. That the goals you have, the things that you think and you want, will likely not come unless you have accurate information and you use that to put together to gain understanding of yourself, your child, psychotropic drugs, how they all work, what it is, what it's about, what are the possible effects and what you can do about it. This information is empowering. So let's dive into the history. In 1930, you can look this up. The first well, I don't know if this was the first, but a stimulant drug was created, benzodrine. Now you can Google something as simple as, let me pull this up. This might be helpful. So let me pull this up. For example, you can just Google 1930 stimulant drug. That's it. And you can start to find information, right, about what I'm sharing today. So benzodrine was created. Now, later in the 1930s, there was a center, a home. It was called the Emma Pendleton Bradley Home, and Dr. Charles Bradley and nurses ran this home for children of various troubles, disturbances, challenges. Now, again, they were just kids that had problems, and this was a place that took care of them, educated them, and worked with them. You can find all this information. ABC. Check the sources. Now, back then, Dr. Bradley was doing. It's a technical term. I'm probably going to mess it up, but anyway, it's encephal. It begins with an E. Okay, I'm not even gonna stumble over the word. But the term was the E test was a spinal tap because they were trying to, as far as I can tell from historical information, they were just trying to take a scientific approach to trying to understand what might have been going on with some of these kids. Part of the testing they did were these spinal taps that, as far as I can tell from what I've seen in more than one historical reference, they were not doing anything to try to hurt the kids or anything. They were just trying to go through a process of trying to understand what may be going on with the kids. And the spinal taps would cause the kids to have very bad headaches. So benzodrine was a drug that was marketed for things like nasal congestion. It was uh, to kind of maybe even stimulate or uh, okay. Instead of me stumbling around, let me uh, okay, here it goes. Benzodrine, this is from just Google, right? 1930 stimulant drug, but here's some information. Okay. The American pharmaceutical company Smith Kline French started marketing an amphetamine containing inhaler called Benzodrine in 1932. So I think in 1930, either Benzodrine or maybe it had a different name, but that's the first historical reference of an amphetamine that was marketed that I could find. But here we talk about benzodrine in 1932, which was available over the counter and used to treat asthma and nasal congestion. However, people quickly discovered its euphoric and energizing side effects. Well, Dr. Bradley thought that this drug might help the children alleviate their headaches. So he gave them the drug. As far as I can find historically, it didn't alleviate the headaches, but what it did do was cause the children to be more studious. Well, so they gave it to 30 children, and it's recorded that about half of them became more studious, became more focused on their chores, like doing their making their bed. They became more calm. A lot of the impact that stimulant drugs have on people today is what occurred back in 1930. I believe it was 1937 with Dr. Charles Bradley. Dr. Charles Bradley went on to publish about the effects of the drug on the children. And this is what occurred. Now, when we look at this, what we have historically is what? A drug. And then when the drug was introduced into the system of children, this was the effect that it has had throughout history. Let's look at that because that is an important theme and web throughout history. So I want to pick up here with Dr. Keith Connors. Now, why is Dr. Keith Connors important? You may or may not have heard of him. He is referred to not by A.J. McMahon, but in history as the father of ADHD. Dr. Keith Connors, Daddy ADHD. Okay. That's what he's referred to in history. All right. Now, Dr. Keith Connors is referred to as the father of ADHD. So I wanted to look into and understand Dr. Connors. And when I looked into him from a historical standpoint, again, the narrative suggests things about Dr. Connors as quote unquote the father of ADHD that Dr. Connors' history and work doesn't suggest. We get below the surface, going back videos when we talked about the pot pie, which can look like a pie on the outside, but inside it's different. It's got veggies and all kinds of different things in there. So a lot of times when we look into the history, we see different things. When we get to understand Dr. Connors, the quote unquote father of ADHD, his work doesn't reflect that he was thinking about, theorizing, or focusing on ADHD. We pick up with one of his publishings in well, okay, this is a publishing, and we'll get to the year. Let me save that for a second. But this publishing was Dr. Keith Connors, and he entitled this publishing in a psychiatric journal or a medical journal, basically, the effects of methylphenidate on symptomology and learning in disturbed children. Methylphenidate is Ritalin. Methylphenidate is, when you look it up, the generic term for many or several, more than one ADHD drug that's still out there today. Okay. So the effects of methylphenidate on symptomology and learning in disturbed children. Here's what Dr. Connors and Dr. Leon Eisenberg wrote. Stimulant drugs have been recommended for the treatment of behavior disorders in children for several decades. When Dr. Connors writes this, he says stimulant drugs have been given to children with behavioral disorders or for behavioral disorders for several decades. Now, when does he write this? He writes this in 1963. So in 1963, he starts off by saying stimulant drugs have been given to children for several decades already by 1963, over 50 years ago. All right. And here's, wait, did I have that math correct? 1963. Nope. Wow. Can you believe it? Wow. Over 60 years ago. Wow. Anyway, okay. Yeah, my math sometimes ain't math, and my strong suit is in love and accurate information, not math. All right. So y'all don't laugh at me out there. And if you do, that's okay. We're going to have a good chuckle. All right. Let me continue with what Dr. Connors writes here. Despite this long period of use and numerous clinical reports, there have been relatively few controlled studies on these agents. Their effects on specific psychological functions have not been adequately explored, and there is as yet no completely satisfactory explanation of their action. Listen to this first paragraph. Pay attention. At, when I say pay attention, I didn't mean that for that to come across derogatory. What I believe is this world doesn't want us to pay attention. I believe this world wants to convince us that we can't pay attention. I believe that sometimes we are so caught up in the things of life that we've got to really be intentional about paying attention. And part of that is me communicating that we have that capability, I think, beyond the challenges or maybe even beyond what we believe. So please understand from my heart that is an encouragement for us to do what I believe the world doesn't want us to do, to really listen to what is being communicated, to really understand what's been going on. And if you need to replay this, please do so. So Dr. Connors and Dr. Eisenberg go on. In a recent double-blind study at a training school for delinquents, we were able to demonstrate on two independent measures statistically significant improvement in behavior among children receiving dextroamphetamine. As a further step in the accumulation of behavioral data on the psychopharmacologic actions of stimulant drugs, we undertook the present study of methylphenidate, an agent which has been reported to be effective in clinical trials. Okay, so what did Dr. Connors and Dr. Eisenberg? They wanted to just do a study to find out more specifically or more in a more controlled way what are the effects of these drugs on children and their behavior. They were not looking for, now you might say, well, this was 1963. Maybe they didn't have understanding that we have today of the brain and disorders and things like that. Again, that's a narrative backwards approach. When you look at events historically as they move forward, we pick up with Dr. Connors, the father of ADHD, who was not theorizing about ADHD or mental disorder. He saw that children had problems, behavioral problems, and he wanted to understand what effects the drugs had on them. The drugs, not the medicine, not anything. What do these drugs do when children take them? And from that, Dr. Connors created a rating scale, an assessment. The most popular one is called a teacher rating scale. All right. But even that is deceptive in the backwards, the beware of backwards look of history, because I was shocked to find when I looked it up, and hopefully I can find this in my pages in my notes here. Okay, that the full title of the assessment that Dr. Connors created was a teacher rating scale for use in drug studies with children. Why is this important? Because the narrative about Dr. Connors is, well, let me get to that. Because, see, Dr. Connors created this assessment that really became the foundation of assessments today. They may have gotten more elaborate, but in some cases they haven't. In some cases, many cases, assessments of a child being diagnosed with ADHD pretty much comes from Dr. Connors' work. And even though they may have gotten more elaborate in some ways, there is still no basis for determining that a child fits the criteria of ADHD other than a subjective assessment. Now, some of you out there may say, well, my child had a 3-hour study. it still boils down to that being an elaborate subjective assessment. Some people may say, well, my brain scan. The DSM, the Diagnostic and Statistical Manual of Mental Disorders, the only book that classifies an ADHD as a diagnosis, indicates in the criteria that all such brain, all, and it has all in italics. You can read this for yourself in the criteria of ADHD, that it basically debunks all, their words, brain scans. So when it comes down to it, the American Psychiatric Association and the World Health Organization do not back these tests, right? It just comes down to subjective assessments that basically a large foundation of that came from Dr. Keith Connors. And why is that important? Because when you look at it, we have to understand through history as it flowed forward, Dr. Connors wasn't trying to uh, wasn't theorizing about ADHD, even though others were theorizing that there were brain things going on. Dr. Connors had children that had. I mean, sorry, I'm not saying he had children. I'm not talking about, like, yeah. Anyway, okay. I'm just saying, Dr. Connors worked with children. All right. Sorry, that was a little loud. Okay. Dr. Connors worked with children, and Dr. Eisenberg worked with children that had troubles. They wanted to try to help them. As far as I can tell, they tried the drugs in a more controlled fashion to see the impact. And then they created an assessment to match children that might be displaying the symptoms in which the drugs might be an effective method of addressing or reducing those symptoms. You can read his work. That's what it was about. And today, that it's gotten a lot more narratively. Okay, it's my own little word I'm creating. A lot more narrative about it to try to get us to swallow this idea that it's about a brain thing, but historical accounts don't back that up. ADHD now used to be called brain damage. Yes, look it up in history. It was then called minimal brain damage because it was suspected that it was caused by basically brain damage. Now, the terms attention deficit hyperactivity disorder didn't come from some kind of scientific finding or revolution. It came from a name that was more palatable. That's it. The name was more palatable. There wasn't some kind of scientific understanding that changed the name. It was just a name that was preferred over brain damage or minimal brain damage. So when you think of ADHD, and as much as we have adopted that term, it is not, it is, excuse me, it's not different historically from what was called brain damage. When we look at these things, we get an opportunity to be able to understand that a narrative has been shaping decisions. A narrative had been shaping what we what uh, our confusion. A narrative has been put on history. We get an opportunity to get the beyond the narrative, to see ADHD for what it is, not what we think it should be. Why is that important? Because when we get to look at things for what they are and understand it from a historical perspective, we get a chance to be challenged. We get a chance to be confused. We get a chance to ask questions. And on the other side of that, we get a chance to realize that that it's we get a chance to understand what's going on. We get a chance to look at the psychotropic drugs throughout history and understand them for what they are. Not good or bad, but we get a chance to understand their role, what they do, what they've done since 1937, is the same stuff they do today. They have an impact on us as human beings. They can create outcomes. That's not good or bad, except we get to understand that and understand that the narrative of brain divergence, the narrative of brain disorder, the narrative of the brain is not substantiated by science, by the DSM, by historical events, none of that. We get a chance to understand that and not judge ourselves or that. We get a chance to say, what does this mean? What does this mean for me? What does this mean for my child? How can I investigate this further? That I can ABC this thing. I can ask some questions now. I can even ask some hard questions. I can beware of backwards and look at information in a forward context or history in a forward context. I can get that context, the C in this, and then be able to use my wisdom to draw that forth to create an understanding. And from there, and even in this journey, tap into resources that's going to bring me full circle to understanding myself, my child, and what we can do so that we can truly empower them, not judge them, not judge my decisions, not judge psychotropic drugs or medicine or whatever you want to call it, but to see it for what it is, understand its role and its purpose, what it can and can't do, but the bigger picture that goes along with that. That is the empowerment that is there for us, the understanding, the passion, the dedication that we have to be able to break free from what we've been given and these morsels to the full buffet of information to be able to apply that with wisdom and understanding. And we're in this journey. You have questions likely. And I'm not the only source of answers, but I am one source. And I encourage us to continue on this journey because in this journey, it's all about getting to the point where we can clear up confusion. We can help you shape your plan. We can help you go from maybe a place where you maybe thought you were empowered, but then realize that maybe you really weren't. But then you can get to be truly empowered in a way that's going to be transformative for yourself and your child. That's what we're here for. That's what we're here to do. So please stick with me. Stay tuned, stay connected, stay involved. And thank you for being here. Thank you for not giving up. And when things get challenging, please share, please like and subscribe so we can stay connected. Please share this with someone else. Please have conversations about it. Please feel free to comment or ask questions in the chat. But also, let's make sure that we're doing this in this process, not just for, we're not trying to get clicks or likes. We're here for love. So please communicate in love, ask questions in love. Let's be able to be in a journey. We're people, we're reasonable human beings. We can be in a journey together that can be challenging, yet we can do it in a way that's loving and that's beneficial. And so any of that I'm here for. Thank you for being here. I look forward to continuing this journey. Next time we're going to do part 4. And all right, I'm going to be honest with you. I'm not exactly sure exactly what part 4 is going to be yet. I'm trying to decide between a couple different things. If you notice in each of the videos, the name of the parts kind of has a word that begins with D in it, like part 2, drugs, dissemination. I'm sorry. Disorder, dissemination, divergence, part 3, drugs and history, that kind of thing. So it'll have some kind of um, theme that's going to correspond and correlate. But let me stop belaboring this and just say, yep, I don't exactly know. But hey, that can be part of the adventure. The D can be discovery. Yes, not saying that's going to be the title, but yes, you get to discover next time what the video is going to be about. And hopefully that'll be in 2 weeks. And I'm thankful for you. Hang in there wherever you are. Tap into the resources at powerofable.com. They're for you. And let's continue this journey together. Let me share this medical disclaimer if I can find it, because it's just an thing we do in these videos. Okay, all information that I present is designed for education and hopefully encouragement. Nothing should be considered or used as a substitute for medical advice, diagnosis, or treatment. If you're suffering from a medical condition, please seek immediate attention and use this information at your own risk. All right. I want to encourage you out there, and be well, be blessed, and we'll see you next time.